everybody, today I'm going to give you a simple overview of clinical governance and how it relates to quality healthcare. This practical video is helpful for students on leadership modules or any healthcare professional preparing for an interview, as you might be asked questions about clinical governance, especially as you progress your career. So I hope you find this simple overview useful. So I'm going to start by setting the term clinical governance in context with other core umbrella terms linked to what is quality healthcare, quality improvement and quality assurance. And these terms are sometimes used interchangeably across healthcare publications, for example. And in an interview, you might be asked a question relating to one of these terms or all of these terms. So you need to know the differences and how they relate to each other. So it's helpful to firstly think about what is quality healthcare, and you might use this at the start of an assignment, or you might in an interview be asked, how do you define quality healthcare, or how would you measure quality healthcare in the role that you're applying for? So it's important to understand the concept of quality healthcare. A simple way of looking at this is using the three criteria used to define and measure quality in healthcare, which are safety, experience of care and effectiveness of care. And these three criteria were initially published in the Department of Health 2008 report, High Quality Care for All, the NHS Next Stage Review. All my references are presented at the end of this presentation. And you'll probably see these three domains reflected on NHS Trust websites and in many publications relating to quality healthcare. There's lots of other definitions of quality healthcare out there, but I think this is quite a simple one that's useful for assignments and interviews. So if we look at safety, so safety relates to quality care, doing no harm to patients. So you're decreasing risk through using risk assessments or safeguarding procedures, instant reporting, and adhering to standards and policies. Experience of care relates to providing compassionate, holistic, person-centred care, meeting patients' needs so that they have a positive experience in healthcare, whatever healthcare service they're using. And we review and monitor patients' experiences through patient feedback surveys and questionnaires, for example. Effectiveness of healthcare relates to promoting positive clinical outcomes. So, for example, preventing complications of post-op surgical infections, preventing complications of care. And it includes reducing waiting times, preventing delays, preventing mortality, for example. And nowadays, looking at sustainability, reducing waste relates to effectiveness of healthcare. And these three Department of Health domains or areas also interrelate. So, for example, patients' experience is less likely to be good if the care is unsafe or it's ineffective, your operation is delayed for weeks. So they're interrelated. Two other helpful papers, practical, to get an overview of quality in healthcare if you're doing essays or have an interview coming up, are from the King's Fund. So I've also put them obviously in the reference list at the end. So Alderwick et al. 2017, Making the Case for Quality Improvement, Lessons for NHS Boards and Leaders, and Ross and Naylor 2017, Quality Improvement in Mental Health. So I hope you find those papers helpful. When we look at the term quality improvement, this is a broad umbrella term and concept, and it originally came from manufacturing industry for any of you that are interested. It involves a systematic approach to improve healthcare, and it involves methodical frameworks or tools to improve healthcare practice, systems or processes. We've got a range of quality improvement and change management models to implement change and improve quality care. So for example, we've got the Plan, Do, Study, Act, the PDSA cycle, which is used to implement change in practice to improve quality. The overall aim of quality improvement is to improve patient care through enhancing patient safety, clinical outcomes or experiences of care. And that also might involve staff experiences, improving staff knowledge or skills too. So for example, you could provide a training program that promotes safe standards of care, which will ultimately improve and enhance patient safety. Or you could develop strategies such as clear career pathways to retain staff in the role. So if we retain staff in their role, the quality of care should be maintained, or if we recruit more staff, it should be improved. It's not just about having lots of staff, they've got to be led well, and it's about the culture and how staff are supported as well. But if we think about the three criteria from the Department of Health of what is quality health, care will be less effective is one, effectiveness. So care will be less effective if staffing is low. Patient safety is a criteria that may be compromised with low staffing, and the patient experience is going to be affected. So in summary, quality improvement aims to standardise processes and structures in healthcare to reduce variations and to improve patient outcomes. An example might be introducing a screening tool to improve early detection of sepsis. So if you use this tool, variations should be reduced as staff are using a standardised screening tool. Patient outcomes should be improved as patients should be identified earlier and given antibiotics. So ultimately, cases of sepsis and patient mortality should reduce. If we look at quality assurance, again, a term that you might be asked about in an interview, quality assurance is about maintaining quality standards. So it's a classic question in an interview for a senior role, band 6 and above. How do we maintain quality standards? How do we measure quality standards? How do we assure care? And quality assurance is simply about making sure quality care happens, making sure clinical risk harm to patients is reduced. You do this through a variety of means, ongoing monitoring and measuring of quality care against agreed standards to assure quality care. Firstly, I would say going out and talking to patients, observing what's going on, but getting feedback from patients is one of the best measures of quality care. We use audits. An audit measures whether the quality of service meets a defined standard. So, for example, we conduct a handy hygiene audit on a hospital ward to monitor staff hand washing. So we know the standard required for safe hand washing to reduce infection risk. And in the audit, we evaluate whether staff are adhering to that standard. And one of the outcomes might be that 50% of staff are not adhering to the correct hand washing procedure, which poses a risk to patients. So there will be learning from that. So it's cyclical because there's a learning from that audit. We might put in training, for example, and then we re-audit later to see if it's improved. And this quality assurance aims to assure patient safety by decreasing infection risk, spread of infection if poor practice was observed, for example. So as well as policies and procedures, we have safe standards of care, all trying to assure, it all links to quality assurance, trying to assure that quality care is being delivered. We might use service evaluations, get more formal feedback from service users through questionnaires, and patient surveys. We use standardised care pathways, and care plans again are aiming to assure quality care is delivered to patients, and you record on a patient care plan that standardised care has been delivered, for example, that adheres to national policies. Nowadays we've got electronic patient records that promote quality assurance. So for example, EPR systems aim to measure and monitor that nurses are administering medications on time. And they will ping a red alert in EPR if they don't. And this monitoring of care, again, is part of quality assurance in healthcare. So quality assurance is essentially a process for checking that quality standards have been met. And as I said, there's a variety of strategies, audits, risk assessment, service evaluations to assure that quality. So if we now look at clinical governance, and if you're a healthcare student, you might find this widely referenced clinical governance definition useful from Scally and Donaldson, 1998, and the full reference is at the end of this talk. And how does clinical governance fit with quality improvement and quality assurance? Clinical governance relates to accountability, and you'll see in this reference a framework through which NHS organisations are accountable for continually improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish. So you can see from the previous definition that clinical governance involves accountability, as the NHS is accountable to the public. Clinical governance is a broad term. It encompasses a range of quality improvement activities and quality assurance processes. Clinical governance in healthcare involves overarching systems and frameworks to hold healthcare organisations to account. They should aim to sustain and improve the quality of their services and safeguard standards of care. So clinical governance involves quality improvement tools like the PDSA cycle. It involves quality assurance tools such as audit tools, service evaluations. And as part of clinical governance, healthcare organisations must evidence that those standards have been met and maintained to provide quality care. So government bodies will hold healthcare providers to account. They will review and check that robust clinical governance systems are in place. They will monitor outcomes and standards such as waiting times, number of incident reports, complaints that are indicators of poor quality or quality care depending on the data they receive. So as part of clinical governance, how do organisations' evidence standards have been met and they're providing quality care? All healthcare service providers will have a lot of quantitative data. They will be monitoring using clinical governance leads, for example. They'll be looking at the number of incidents being reported and complaints. So they'll have a lot of data that's being monitored linked to clinical governance. Risk management is a big part of clinical governance, and that involves predicting and evaluating clinical risk, identifying strategies to avoid and minimise future risk. As healthcare professionals, right from when you start as a junior, starting your career, we use incident forms. We regularly use risk assessments to assess risk level, and we implement actions according to risk assessments. We analyse data from clinical incidents and complaints as part of risk management. An example, we see an increase in falls on a ward using incident reporting. We have this sudden increase in patient falls, and the manager will then need to investigate why there was this sudden increase during this time period. Was it linked to poor staffing levels? Was it linked to lack of staff education and knowledge? And then future strategies can be devised to prevent future patient falls. And that's all part of risk management. We learn from incidents and complaints, patient complaints or relative complaints. Clinical governance also involves the implementation of evidence-based standards, policies, guidelines, and care plans. So, for example, you might have a clear escalation pathway for patient deterioration as part of standardised care. Clinical governance also involves auditing and service evaluations, and we repeat those audits and service evaluations to monitor standards that can decrease or improve. So doing an audit or a service evaluation only gives you a snapshot at that time. So we have to continue to get feedback from service users. We use friends and family tests. We have external reviews, for example, as well, from the Care Quality Commission, the CQC. And we learn from that feedback, and that will feed back into training programs, education and training of staff. You may also be interested in the 7 pillars of clinical governance, which originally came from Donna Bedian in 1993. The full reference is at the end of this talk. Also, Nichols et al. 2000 reference is helpful as it gives a historical overview of clinical governance, its origins and its foundations in their paper. So the 7 pillars of clinical governance, you'll see that I've already mentioned some of these areas such as audit and risk management in previous slides, but the first pillar is clinical effectiveness. This links to current research, evidence-based practice, standards, implementing NICE guidelines, national service framework set by the NHS, which you'll find on government websites, to ensure best outcomes for patients. So if you've got an interview coming up, you should be looking at what NICE guidelines link to this service, this role, what national service frameworks linked to the role. So there's national service frameworks for the older person, for example, if you're working on a older person ward. Risk management, second pillar, already been covered really, but links to incident reporting, learning from mistakes, near misses, adverse events, links to risk assessments, identifying risks, and implementing processes and strategies to reduce risk. Third pillar links to patient and public involvement. So we get patient feedback from questionnaire surveys. We have patient networks, charitable networks, locally, nationally, that feed back and are part of clinical governance. We also have NHS Trust Board of Governors, for example. They've got public or patient representation, usually on NHS boards. Audit, is a fourth pillar where we measure the quality of care against an agreed standard. So, for example, infection control audit or adherence to clinical guidance standards such as storage of medications. So clinical practice is continually being audited, so any deficiencies relating to that set standard can be addressed. Then we have staff management as number 5. So as I mentioned earlier, appropriate recruitment, retention of staff, management of staff underpins quality care, and underperformance should be addressed as well. But if a staff member is struggling, what support mechanisms are there to help staff? Employers should also provide good working conditions. That's all part of staff management. Education and training, pillar 6, so enabling staff to be competent through education training, annual appraisals, staff compliance with statutory mandatory training, which is measured, and the completion of appraisals. They're measured nationally and locally. How many staff have completed appraisals. And in interviews, often nurses going for sort of more leadership roles are asked how are they going to ensure or promote compliance with statutory mandatory training and appraisals as part of their role as clinical governance. Information is the final pillar, and that relates to patient data, information technology. Your data should be accurate, up to date, confidential, adhering to National General Data Protection Regulation, GDPR, for example. So on my YouTube channel, I have lots of free videos relating to many aspects that I've talked about that give a bit more detail. So risk management in healthcare that links to risk assessment, instant reporting. I've got a bigger overview linked to clinical audit in healthcare, the PDSA cycle, using an example quality improvement project, the difference between research, quality improvement, service evaluation and audit, clinical incident reporting, quality improvement project versus a service evaluation. So lots of different videos on there that might be helpful for future interviews or as part of your assignments. A few more additional resources linked to quality improvement. NHS National Service Frameworks you'll find on government websites. We've got a National Service Framework for mental health, for children, young people, and maternity services, and for older people, for example. So very helpful to prep for interviews. We also have national NHS quality priorities. So for example, on NHS England website 2024 to 25, there's priorities and operational planning guidance. So for example, improving ambulance response and A&E waiting times, reducing elective long waits and improving performance against core cancer or diagnostic standards. And then there's more specific objectives such as improve category 2 ambulance response times to an average of 30 minutes across 2024 to 25. There's another objective to eliminate waits of over 65 weeks of elective care as soon as possible and by September 2024. So these quality priorities are always ongoing and changing. So if you have interviews coming up, it's always worth looking at those NHS quality priorities and to see which ones relate to your service. Also NHS websites for quality improvement frameworks, models and tools. We have quality improvement hubs. Many employers and NHS trusts now have leads and networks of quality improvement, and they provide resources to support staff members wanting to pursue a quality improvement project, for example. We've got the Healthcare Quality Improvement Partnership website, the Institute for Healthcare Improvement. Again, they've got websites with lots of useful resources, and then professional bodies such as the Royal College of Nursing, clinical governance professional resources. So I hope that helps. So finally, I've got my references, so I'll go through them. I won't go too quickly because it's difficult for you to stop the video to see the reference. So Alderwick et al. 2017, Department of Health 2008. We have the Donabedian reference 1993, Nichols et al. 2000 reference, and Ross and Naylor reference 2017. And then Scally and Donaldson reference, sorry I can't speak today, 1998. So I hope you find these references helpful if you've got an assignment coming up. There's lots more out there, but I've just picked some simple references for this talk. So if you found this video helpful, don't forget to give it a like. If you have any questions at all, don't forget to put them in the YouTube comments, or if you prefer to DM me, you can DM me on my Twitter. And I have 2 books. I'm an author, and if you're interested, there's sometimes in the library these books if you don't want to buy them, but How to Thrive as a Newly Registered Nurse, with lots of tips to support someone that's newly registered. And then my other book, How to Prepare for Interviews and Develop Your Career from a junior role right up to a band 8 really. So I hope you find that helpful. If you do choose to buy the books, there's some links in the description.